100% VA disability rating for sleep apnea falls into this category. But let's read through it and maybe you could explain what this actually means. So you have a chronic respiratory failure with carbon dioxide retention, and so you have those two things and require a tracheostomy. What does all that mean?
Okay, so chronic respiratory failure. You could have like a COPD.
COPD?
That could be, yeah, chronic respiratory failure. You could have
Okay.
Somebody might have been a smoker or somebody who was around chemicals or inhaled something for a long time. So you've had some lung damage and
So like what does that look like? Whatever the diagnosis of it is, it could be a few different things. Like, does that mean that you just chronic respiratory failure? That sounds pretty bad. Whatever it is, do you have problems breathing anyway? Obviously, the tracheostomy part hasn't happened. We haven't talked about that yet.
No, so you're retaining more carbon. You're not able to exhale that carbon dioxide. We inhale oxygen, exhale carbon dioxide.
Okay.
So in our lung where the air exchange happens, the air gets trapped and we're not able to puff out that carbon dioxide. We retain a lot of it. So that's what happens with a lot of people who have enlarged lungs, on difficulty breathing, exhaling, can't catch their breath. They keep inhaling more than they do exhaling, and requires a tracheostomy. That might be a little bit extreme, especially these days, I would think, with more technology that's out there.
Is that the tooth thing?
Yes. I've seen it written in some charts where, if you're not able to wear a CPAP and you're not able to, and you're high up there and you've got some horrible, let's say sleep apnea, go back to that 50% rating, for example. If you're somebody who won't wear a CPAP and you've got severe sleep apnea, the doctor might say, you know what, we're going to do maybe you need to have a tracheostomy. You got to do something. I've seen people stop breathing 125 times an hour. That's significant. And if you're not going to wear a CPAP, you're killing yourself for sure.
So this is how we're not going to be a part of that. We're going to jab a hole in your neck and force you to breathe a different way, if that's where, because clearly you're not using, I use it every night. No, you don't.
Sure. Right. So along the same lines with this, 100% rating, there's got to be some underlying reason maybe why they can't use maybe some sort of assistance as far as, because we see a lot of people still on CPAP for these kind of things, but to put on to actually do a tracheostomy is pretty extreme, and maybe that's exactly what they need.
But also, I don't have the I'm looking at the law, but I don't have the date it was written. Like, this is not current medicine. This has probably been on the books for 20 or 30 years. So,
there's new things that are happening out there that can actually assist with some of this. So it could be, like you said, old written law.
Yeah.
Or so I think that maybe there's things that potentially need to change. Even enlargement or failure of the right side of the heart due to lung disease. Again, all that has to do with just whatever's going on with the lungs, extra pressure on the heart, and squeezing the extra pressure in that upper, chest cavity. So that's, you're going to go see a pulmonologist. You're going to go see a heart specialist, and they're going to actually help diagnose this.
Okay. There are 2 times when you don't need a nexus: when you file a claim while you're still on active duty, like a BDD claim, or when you're in the 1-year presumptive period. Any other time, you need a nexus. You also need a strategy. Check out my boot camp and contact my med team if you need a nexus. So 100% rating, kind of for multiple reasons. You're kind of explaining one of them. I think this is a little dated, but so is a lot of law. And if it's not dated, it's squishy on purpose. Regardless, 100% rating for sleep apnea is, you need to fall into a couple different weird buckets, according to this law.
I'm thinking we're still under the sleep VA, the VA ratings for sleep apnea. So even at 100% rating, we're still talking about some sort of apnea going on. And whether it's congestive heart failure or COPD, either one of those, it's still treated. We still treat it with sleep apnea, and if not, maybe it's a vent. Maybe it's not, like I said, there's ventilators that are out there, and people have them at home, and they can puff on them during the day. They can sleep with them at night, sort of like they do with the CPAP, but it helps them. It's a better assistance to their breathing than just a straight CPAP would be.
Okay, that makes
It's got a
sense.
different modality.
Gotcha. Modality, that's a good word. Modality is the word for the day.